Okay, for an ostomy bag, they give you a generalized sticker pad that you have to cut the size of your opening into the bag. Comes with a peel-off plastic protector. And then you have, this is what they call adapt. It's kind of like a, I don't know, it's a goo sealer that keeps your bag from leaking. It goes, some of the stuff's getting pretty old. I've had it for a little while now. We're gonna have to use the other one. That one's no good.
Throw it away?
I will. Stuff gets really sticky if you're touching it, which is a good thing because it keeps everything from going where it shouldn't go. That's kind of what it looks like. Kind of like a bit of putty. Okay. Got to get everything ready because with the bag here, you never know when it's going to do what it wants to do. Now the painful part is peeling off the sticker because the hair in my stomach wants to grow back all the time.
Which is good, right? You're out of chemo.
Yeah, your hair's growing. That means you're no longer in chemo, but ooh, it's worse, 10 times worse than pulling off a Band-Aid. Sometimes I gotta cut the hair because it's just so long. That's a little painful. I'm gonna clean it up a little bit before. Give you little bags to throw all the stuff in. It's never a fun thing to do, you know. Gonna have to put a disclaimer at the beginning of the video. As you can see, I don't know if you're looking at it or no.
Yep.
It's kind of nice and red around the area. It's hopefully next month I should be getting this reversed and put back to normal, but I wanted to just kind of show everybody, maybe somebody out there who's getting one of these or who has one, or a little bit of what to do, what not to do. You got hair, you got to cut it. Even if it's not that great of a cut. They give you these little cleanup pads. It kind of helps with the burn because this stuff being on 24 hours, 7 days a week tends to burn a little bit. And then you got a spray cleaner. Use a dry cloth, clean that up, dry it off so it sticks. It doesn't hurt to wipe off the inside there, don't really feel it. And then you gotta put this pad on. Make sure you get that squeezed down over top of it. They give you this, it's called a stoma powder. Put that on. Keeps everything from getting too moist. Get a bag. Gotta really make sure these are on because if they don't, I almost had a couple accidents. Clicks, click, click, click. And then on the sides, It's like a nice big sticker pad. Pull it off as smooth as possible. Same thing on this side. Try not to get any little ripples in it because then it doesn't want to stick too well. Kind of push down, gets that goo in there nice and firm. And then to clean this out, because this is now your stomach or your intestine that empties out, this opens up at the bottom. And you squeeze it, opens up to let everything flow out. But when in the beginning I was just letting it flow out, squishing everything out, it's kind of nasty. So what I do now for months is take a cup of water, put some warm water in it, pour it in before I empty it. Warm water, close this up, swish it around, gets everything liquefied, open it up, dump it into the toilet. Got to get really close because it tends to splash that way, but do that 2 or 3 times and the bag is pretty clean after that, because I don't like nasty bag under my shirt, you know. But that's all I do. Pretty simple, but not so simple, you know. 10 months of this thing, you're ready to get rid of it. So that's it for changing the bag out.